Hi, welcome to NCLEX with Anju. Today we will discuss about tuberculosis in simple way. Tuberculosis is an infectious disease caused by a bacterium named Mycobacterium tuberculosis. This disease condition usually affects lungs, but it can also affect other parts of the body such as brain, intestine, peritoneum, kidney, joints, liver and even spine. So TB can be spread when a person with active TB disease releases germs into air through coughing, sneezing or talking, and when they travel into our airways and infect our lungs. So the mode of transmission is airborne route and droplet route. This Mycobacterium tuberculosis is an aerobic bacterium, needs oxygen for survival and growth, and usually found in well aerated upper lobes of the lungs. That means this bacteria needs oxygen for survival and growth. As our lung has high levels of oxygen, this bacteria can settle in our lungs and begins to grow. From there, they can travel through blood to other parts of the body and infect our body. So when these bacteria are in our lungs, our body's immune cells called macrophages comes to the area of infection and try to kill and break down the bacteria. In many cases, this response is enough to remove the bacteria from our body. And at the same time, our body's inflammatory system triggers and other defensive materials comes to the area of infection and try to remove the bacteria. Together, these macrophages and defensive materials form a massive tissue called granuloma. That means now the bacteria are inside the granuloma. The granulomas are like a cluster of tissue which can be visible in the chest X-rays. Usually the granulomas are visible in chest X-rays like in a patch form. And this is the reason we can see patches in the chest X-rays of a person with active or latent phase of TB. Have you heard about active and latent phase of TB? So here is the difference. You might be heard that someone diagnosed with TB but still he is not contagious, and if other one diagnosed with TB but he needs to be isolated. So what is the reason? We will see in detail. So here this is latent phase of TB and this is active phase of TB. In latent phase of TB, the microorganism enter into the person's body, but he had good immunity, so his immune cells called macrophages comes to the area of infection and try to absorb the bacteria, and at the same time other defensive materials also came to the site of infection. So together these macrophages and defensive materials form a granuloma. So that is a cluster of tissue. Now the bacteria are inside the granuloma, so which will be visible in the chest X-ray. But the bacteria are in dormant stage. Dormant means inactive stage. These bacteria can stay inside the granuloma for many years. When the person's immunity becomes low, this bacteria can regrow, multiply and infect that person. Okay, so in latent phase of TB, this person is not contagious. Chest X-ray might be normal, no signs or no symptoms, and negative sputum culture. But PPD and blood test might be positive because already this person has antibodies of tuberculosis. That's why PPD and blood test might be positive. But still this person needs treatment because anytime this bacteria can come outside of the granuloma if his immunity becomes low and multiply and begins to infect that person. But this is very rare case. Around 5 to 10% only can move from latent to active phase of TB. Now active phase of TB. That means if a person has low immunity, like individuals with HIV, immunocompromised people, malnourished people or diabetes, in these cases, their immune response may not be strong enough to destroy the bacteria or fight against the infection. So in this case, the bacteria when enter into their lung, it will multiply and infect that person. And from that part, it can travel to other parts of the body and infect that part also. So in this case, The person is highly contagious. He can spread the disease condition to other people very easily, and he is with all the signs and symptoms. Abnormal chest x-ray, positive sputum culture, and all other blood tests will be positive, and he needs treatment for many months. Risk factors of tuberculosis are immunocompromised patients, example HIV patients, cancer patients, organ transplanted people. So these people are in risk to develop tuberculosis, and alcohol users, IV drug abusers, older client, or children under 5 years of age, homeless individuals like people living in highly crowded areas or people living in institutions, they are in risk to develop tuberculosis. Now we will see signs and symptoms. Fever, night sweat because of bacteremia, fatigue, coughing up of blood. So the lung is infected with the bacteria. So because of the lung infection, the patient might be coughing up of blood. Chills, unintentional weight loss. These are the signs and symptoms of tuberculosis. Tuberculosis can be diagnosed with the PPD skin test, also called as Montauk's skin test. So PPD injected with the tuberculin needle in the inner part of the forearm, and the result will be reading after 48 to 72 hours, and we assess for induration, not redness, we assess for induration. And next one is interferon gamma release assay, quantiferon TB Galton test, TB spot test. These three are the blood test. Next one is sputum AFB. So for sputum AFB, we need three different samples of sputum in three different days in the morning. Next one is chest X-ray and sputum culture. So these are the diagnosis of tuberculosis. So now we will see PPD reading. So in PPD reading, as we told, we will assess for induration, not redness. So after 48 to 72 hours, we will assess for any induration. And according to the reading, we can diagnose the condition. If the induration is more than 15 mm, it will be considered as positive for everyone. And PPD reading of more than 10 mm is considered as positive for immigrant people, IV drug users, people living in crowded areas, and children under 5 years of age. And if the reading is more than 5 mm, it is considered as positive for HIV patients and immunocompromised people like organ transplanted people or cancer patients. But positive PPD doesn't mean that the person is on active phase of TB. Maybe this person already developed antibodies against tuberculosis because of latent phase, or the person is already vaccinated with BCG. In this case, PPD can be positive, but it doesn't mean that the person is on active TB. So to confirm the TB, we need a positive sputum culture. So without any positive sputum culture, we cannot diagnose the patient as active phase. Active phase of TB can be managed with airborne precautions. And if the patient want to come out of isolation, they have to wear the surgical mask. 6 to 12 months of antibiotic therapy, isolation, strict isolation. And when this person can come out of isolation, so there are some criteria. Signs and symptoms should be reduced, like cough should be reduced, fever, other sneezing. These signs and symptoms should be reduced, and he should have at least 3 negative sputum culture samples. Okay, then on medication of at least 3 weeks. So at least 3 weeks of antibiotic therapy he should have completed. So in this criteria, the person can come out of isolation. But if the person has latent phase of TB, no need to be isolated. He has to take 6 to 9 months of antibiotic therapy. The person with tuberculosis has to take a combination of antibiotic therapy. First one is pyrazinamide. Pyrazinamide is an antibiotic. It has the side effect of getting GI upset, so we have to take with the food. Then it can increase the uric acid level. So we have to observe if the patient is diabetic, or the patient has kidney problem, or the patient has gout. Then ethambutol. So ethambutol can have the optic nerve damaged. So in this case, frequent eye checkup is needed. So vision changes we have to observe also. Then it also has the other side effect, peripheral neuropathy. It will be evident like numbness or burning in the extremities. So we have to observe that also. Rifampin is another antibiotic, so it has another expected outcome. So this makes the body fluids orange color. So their body fluids, urine, even the tears can be in orange color, and this is an expected outcome, not the side effect. Birth control pills might be less effective, so the patient should take other measures for birth control. Then sunburn can get very easily, so they have to take the precautions and should not take any alcohol, then the medication will not be effective. Next antibiotic is isoniazid or INH, but it decreases the vitamin B6 levels. So we have to take the vitamin B6 supplements. And also we have to watch for peripheral neuropathy and tingling, because vitamin B6 deficiency can lead to peripheral neuropathy, which will be evident as tingling. Monitor for liver function and neurotoxicity. Another antibiotic is streptomycin. It has a side effect of ototoxicity because it affects the 8th cranial nerve. So we have to observe for hearing and ringing in ears. Tuberculosis patient has to follow the strict antibiotic therapy for many months, and this is the hardest part of tuberculosis treatment. But missing an antibiotic can worsen the condition. Hope it was helpful. Thanks for watching. Don't forget to like, share, comment and subscribe, and we will see you in next video.